Check Podcasts.
Hi, I'm Bruce Williams. I'm the CEO of the Greater Victoria Chamber of Commerce. Welcome to Chamber Chats, coming to you as always from here at the podcasting studios at the Czech Media Group. They are one of our chamber champions, in fact. I'd like to begin by acknowledging that I live and I work in the lands of the Lekwungen-speaking nations, the Songhees and the Kosapsum. And all of this is made possible by the support of Island Savings, a division of First West Credit Union, who are changing what banking can do for people, for community, and for the planet. When someone says to you, "How are you feeling these days?" What's your answer? Is that different day to day? Does it matter what time of day it is? Because we very sincerely care about each other, but we know that the impacts on mental health have been profound, certainly before the pandemic, but certainly during the pandemic and afterwards. So we want to check in on everybody's well-being, and to do that, we bring back our old friend Jonny Morris, who is the CEO of the Canadian Mental Health Association for BC. Jonny, welcome back.
Thanks for having me back, Bruce. It's an honor to be here.
How are you feeling?
How am I feeling? Well, it's a great way to start this conversation. I'm feeling grounded, as I always do in these interviews with you. I work from home today, so I'm feeling a bit less stressed. I was at home with my dog, working from home, and I've got maybe a degree of anxiety just about kind of what's happening in the world at the moment. So that's how I'm feeling. Thanks for checking in. And how about you?
I'm good. I'm winding things down at the chamber, so there's a little bit of mixed emotions about that whole thing as well, just waiting to move along to whatever it is I'm going to do next. But the reason I ask about you is that you live this every day, and I hear a lot of things from our members every day about the challenges you're facing and everything, productivity issues to just the straight mental health challenges, the impact of life that's happening on the street. So let's do it this way. The last time you and I did this was about 6 months ago. How is the world around you in the world of the CMHA different now than it was 6 months ago?
Well, that's a brilliant question. And even over the past 6 months, we've seen huge shifts geopolitically in the world, including, with impacts here in Canada, and I think one of the bigger things that we're seeing is the relationship between economics, money, and mental health. And so over the past 6 months, I know people are finding it harder to make ends meet, whether you're a person at home living alone or with a family, or you're running a small business or a large company. Money and mental health are so linked. I think it's one of the biggest changes we've seen and we're picking up in our world. And then, of course, there is a lot in the media. There's a lot playing out in and around big topics and big issues like the Mental Health Act, like public safety, like mental illness, and public distress. So those are, I'd say, the biggest seismic shifts I've seen since we last hung out, Bruce.
Yeah, when you talk about media, there was an article like a couple of weeks ago in the Globe and Mail that received a great deal of attention because many feel that sort of misrepresented the reality of what's actually going on, in particular on Pandora Avenue. So there's a huge amount of blowback on that, but that upset a lot of people too. I know that you weren't in this position in 2019 before the pandemic came along, but in general terms, compared today to pre-pandemic in people's well-being.
Yeah, I mean, well-being. Well, I'd say pre-pandemic, mental health. If you think here, particularly in BC, was gaining some prominence priority-wise. I think at the time we were a number of years into the declaration of the public health emergency related to the toxic drug crisis. And I think as the pandemic started, and I've said this before, for the first time, distress, whether it be anxiety, worry, isolation, depression, really started to affect people at a kind of a grander scale. In many ways, the issues of mental distress were affecting lots of us, if not all of us, because we had this invisible threat to our lives, the pandemic, and of course, people experiencing grief and loss and all of that. But before the pandemic, definitely things felt different. And in many ways, the pandemic galvanized prioritization of mental health and mental health care in a different way. I think things have shifted since then, but it definitely was a turning point. Just as I took this job, actually, I became CEO just as the pandemic was starting, in and around that period of time.
Yeah, and I'm the same because I started in June of 2020. So
Yeah.
we've been riding this out together here. But and a lot of people are sort of thinking, well, the pandemic is behind us now.
Yeah.
But in a way, it's not. I mean, that period of time when we were in lockdown at home, I was at home with my wife. You were at home with your wife and your dog, and you're working through it. But effects of all of that stuff, I mean, it challenged a lot of relationships. But how did all of that lockdown thing change people's attitudes and their overall general well-being and mental well-being?
Well, there's been some recent things published about this, and in many ways, we became quite isolated, or we became quite singular. Like we were cocooned in lots of ways, and fundamentally, big things changed for many folks. And I do think it's really important to ask this question because we are still living out these impacts. You're right, Bruce. It's the pandemic is. I mean, COVID is still a real thing. It's still affecting people, but we are in a different space. But I think there are long-standing effects, not only health-wise with long COVID and those kinds of things, but some of those impacts of being hyper individual or being separated or being isolated has continued, I would say, and just from my own humble opinion, having some real impacts today. But also many people's worlds were turned upside down and haven't kind of gone back to normal. Like if we think about the world of work, the world of education, the world of schooling, there's some things, the world of healthcare. I was just talking with someone today about how none of us, I don't think, really stopped after. There wasn't really a moment after the pandemic to kind of just catch our breath and go, "Wow, this is what we've just been through. What are we going to do differently as we go forward?" We just kind of smeared into the current time with all of the good and some of the difficult and the bad that's come through that. But I do think the pandemic fundamentally changed things for lots of people, and is having long-standing impacts upon mental health and well-being.
Somebody made the comment the other day that people's work from home model is different now because if you've got the sniffles or a bit of a cold, you don't just like pop a Tylenol cold and go to work. No, you stay away from people when you're sick now. So that's impacting productivity. But it's again, that's preying on people's well being mentally to know that they can't really go out if they're sick.
Yeah, I mean, I've talked with a lot of industry and business leaders about that very real question. Things have changed, and in many ways, there's a lot of good to that, right? People are hopefully staying home, getting better, getting well, and there's a lot of debate and controversy, of course, continued around working from home or hybrid and those things. And in my own workplace, we grapple with that too. There's lots of good to working from home, and I mean, personally, I do miss some of the camaraderie and the team connection that can come. So fundamentally, how we orient and shift. I think, I'm not sure if you've heard this from other business leaders, given your role in the worlds I operate within, we're seeing in some of our findings and our data, more reports of workers actually feeling lonely. Like this kind of really interesting finding of, even though we're hyper connected through Teams and Slack and email, people feeling lonely. And I don't know if people were feeling that way when we were all together in our workplaces before the pandemic. But we do know isolation and loneliness has a really, really important is a really, really important factor when it comes to mental health and well-being. And I'm not sure if listeners to this will resonate with, do I feel more lonely in my job at work? It's something to pay attention to and act upon, I would say.
I think you'll be interested to see the results of the vital signs report when it comes out because loneliness and isolation, because of financial constraints, whatever it might be, is going to be a bigger deal going forward. That's for sure. So, something else I'm wondering about too. I just spent a couple of days in Nanaimo with my counterparts from all the chambers across BC, the Chamber Executives Gathering. And I heard different stories from different parts of the province. So, what we want to do here is talk about what did different geographic areas have to offer and what's the perspective on mental health between those places. And we're going to talk about that next. Our guest on Chamber Chats today is Jonny Morris. He's the CEO of the Canadian Mental Health Association for BC. Every place in BC is different, I'm going to say, because you probably see different nuances and occurrences within the mental health profile of different communities. So how much does that differ?
It's a really, really important observation you're making, Bruce. I mean, and the way we come at this is often related to access to healthcare, access to services, access to supports. And if you're living in an urban part of British Columbia, it's true. Like your access to services and supports is very different than if you're living in rural or remote British Columbia. One of the most beautiful things about this province is the diversity of the lands that we're privileged to live on. and it does have bearing on the kinds of supports. It can feel a bit like a postcode lottery for people, when it comes to the available services. I mean, a big top of mind issue for many is, do I have access to a GP? And often GPs are the gateway to figuring out what's going on with your mental health if you're starting to experience signs and symptoms. But I do think geography is a driver, like access to employment opportunities, food security, housing security. All of these things we know and we've known for a long time have a huge impact upon our mental health and our well-being. And it really does behoove all of us, governments, local, municipal, federal, provincial, agencies like mine, to really get creative to make sure no one's left behind. No matter where you live in BC, when it comes to access to the means of good mental health, but also the supports and services needed to maintain good mental health going forward.
I guess even access to green space. If you live in the middle of Vancouver, it's very difficult for you to get out and forest bathe or something, for example. In Victoria, it's a little more accessible, but in big
Mhm.
cities, that can be a problem.
Yeah, and you're touching on something really important. We haven't talked about this a lot collectively, but there are a whole bunch of folks in public health that think about our environments and built environments and what they do for mental health. And you hit on something really, really important. Like, so much research has shown that having time, forest bathing, as you say, being connected to the outdoors, it has huge impacts on feeling good about ourselves and our mental health, and how we design cities. So, like, city planning and how we design cities, really, really important too. And as wildfire season starts, thinking through the impact of climate, thinking through the impact of smoke and wildfire, that's something we're actively working towards. We're working with our branches across the province to make sure that our services are protected and prepared. Because for many communities who've gone through repeated cycles of wildfire season, the toll related to anxiety and worry and fear is real. It's real, and we need to be supporting people as they navigate what's become a new normal here in British Columbia.
Yeah, even that gathering I was at in Nanaimo, as I mentioned, with the chamber executives from across BC, the ones from the north are worried about the fire. We're recording this on June the 4th, just for perspective. But the fires were raging in northern Saskatchewan and places like that, northern Manitoba. They're worried about that happening again very soon. And that's a very palpable sense of anxiety. When you talk, too, about access to healthcare, whether it's primary healthcare or specialized or something else, that's a sector that's under a lot of pressure, a lot of stress. We've heard that, of course, there are mental health challenges in the people that we rely on to keep us healthy. What do you hear about that sector?
Yeah, we've been grateful for lots of support from the provincial government to do a number of things, and one of those things is support the mental health and well-being of healthcare professionals across the province. We have a great service called Care to Speak, which is a confidential phone line. We're seeing continued use of that service, Care to Speak, by healthcare professionals. It's a peer support service, so healthcare workers supporting healthcare workers. We see healthcare workers calling in between their shifts, on their way to their shift, on a break, often using it as a safety valve, a release valve for the things that they're experiencing. And it links back to our earlier part of our conversation where the health system doesn't get to stop, right? It doesn't get to take a breath and go, okay, let's just take a minute here. It's still grappling with the impacts of the pandemic. But I'm really proud of some of the work we're doing, like thinking about crisis, communities, strain on resources. Our circle teams, we have one here in Victoria with 5 teams that are publicly live across the province. And we're close to 10,000 calls with these teams, and really proud that these teams have been able to avoid the need for police, who are a very taxed resource in the province, in sense of the burden on them. We've been able to avoid calling them 99% of the time. So if you think about 99% of 10,000 crisis calls, we've been able to avoid the police coming and divert many of these folks away from the emergency room. So they haven't had to sit in an emergency room, for a period of time. I think it's been really brave of the government to invest in this work. And we've got some great partners in Victoria and beyond leading this work. So there's some really good things underway that are designed to relieve some of that stress on the health system as well.
When we seek support and assistance, there's a whole spectrum of things available. CMHA, your organization, is a nonprofit. Healthcare provision is very often a government thing. So next, I want to just talk about how that all works together and what what the sort of symmetry is between the two. Our guest on Chamber Chats today is Jonny Morris. Jonny is the CEO of the Canadian Mental Health Association in British Columbia. So you got the nonprofits like CMHA and other organizations providing help, support, and counseling. And then there's government services. So you're not government. But so just tell me about that spectrum and the relationship between the nonprofits and the government.
Yeah, previously we've often kind of thought about services like this as a bit of a pyramid, and so the community services, CMHA is one of them. Here in this community, we've got mental health recovery partners. There's Kool-Aid, there's the Salvation Army. There's all sorts of groups at that community level, providing in some ways joined up services, so services that interconnect. Foundry is a great example of that. And then other services that kind of are a bit separate and distinct across this region and the island and beyond. And then we try to endeavor to interface with the health authority system or the formal health system, which provide a range of services, sometimes in community, but often designed for people who are experiencing more severe symptoms. They're a bit more complex, all the way through to hospital-based care in the health system. In an ideal world, we all work together, right? We hold a principle that care is so often better closer to home in community. There's a lot we can do in community, especially if we can tackle housing and employment and training. We do a lot of work in those spaces. And ideally, we kind of marry up and match up with the health system that picks up the baton when people are experiencing more complex illness and that kind of thing. So yeah, we aren't government. We're often confused with government or other things, but yeah, we're a charity like many of the other partners we have in community, and ideally we work in good lockstep with government funded systems like the health authorities and hospitals and things like that.
Yeah. As I mentioned, today is June the 4th. We are recording this on a beautiful, bright, warm, sunny day. 6 months from now, it's going to be December when it's going to be dark. It might be stormy. It might be rainy. That sort of thing, like daylight, has an effect on people's well-being, doesn't it?
Yes, seasonally, there's definitely lots of things. I mean, I think I've talked on the radio often. We get interviewed about Blue Monday, which is fictional, doesn't really exist. It was actually a creation of a tourism company to get people to go on holiday. But there is some truth, absolutely, in evidence to say, as days get darker, there's less light available. Our moods can change. You're absolutely right. And then seasonally, they're depending on things, there's different stresses and strains on people that can also really impact mental health and well-being too. The summer people can experience actually very significant depression in the summer months as well. So it doesn't always hold that the winter is when we see more shifts and changes. People can be affected seasonally in different ways, but it does underscore that the world around us, including the climate and light, all have some bearing on how we're feeling and how we're doing.
We see people all the time in our lives, whether it's at work or socially or just people in your neighborhood, who are showing obvious signs of struggle. Their behavior has changed. Their weight may have changed. So if you see someone that's struggling, what can we do? What could we do? What should we do? How do we best determine what we should be doing?
Yeah, it's a great question. I think it very much depends on the relationship. In so much of our work, if it's a workplace, your school, your campus, your family, if you're worried about someone, so say, I mean, you're a dear colleague of mine, Bruce. If I was worried about you, one of the things I would do is check in with you and leverage our relationship and the trust we have in each other to say, hey, Bruce, I've noticed this lately. I've noticed that you haven't been coming to meetings with me. And I've noticed this about you. I'm your colleague. I care about you. I'm concerned. Can we talk about this? I'm here to listen. I'd say something like that. Often asking that question might go nowhere the first time or the second time, but I've heard from many people that those conversations can be life-changing and on occasion life-saving in lots of ways. It can be trickier if we don't know the person or if we're encountering someone in distress on the street, for example. In Victoria here, knowing that CRCL, the Circle team exists, is a great thing. If you see someone in distress and you're not sure what to do, and perhaps they're behaving in a way where you're concerned, and there's no imminent risk of harm to that person or to someone else, calling Circle, the Circle team, is a great step to get that person connected to really thoughtful, compassionate crisis care in the community as well.
And that's not calling the police, that's calling the Circle
Yes,
group
that's
instead.
calling the Circle team. Yes.
How do we find them?
So you can go online, Circle, and I'll make sure your team has the phone number at your fingertips. But Circle, CRCL, it's operated by AVI in Victoria, the Circle team. It stands for Crisis Response, Community Led. And they are doing a beautiful job in this community. And in actuality, we're hearing that they're actually showing up on city signage. If you're worried about someone, call Circle here in Victoria. So the Circle team is the community-based crisis response team.
What about addressing our own well-being when we look at ourselves, what we're feeling, we might be confused, we might just not feel like we're in a good place. What should we do for ourselves?
Yeah, so knowing this can sound trite to say this, but knowing you're not alone in the sense you're not the only person to be experiencing this. I have my own lived experiences I've shared with you before, Bruce, of depression specifically, and a fair amount of anxiety too. um Trusting yourself, like if you're not feeling quite right, so for example, if your mood has changed, if your appetite's changed, if your sleep has changed, trusting that you know your body and your mind well, and if things are feeling different, knowing you're not alone, and taking those first steps to reach out. If you do have access to a GP, and we know many don't, that's a really often a really good first port of call. You can reach out to our website, cmha.bc.ca. We have a range of programs, mainly for depression and anxiety. The government has a great website, Help Starts Here. If people Google that, Help Starts Here, there's about 2,600 resources on there that you can look up, including free counseling, free therapy, and other resources that are available. If you're worried about a young person, or you are a young person, the foundries across BC are also a great starting place to check in about your mental health and your physical health, because they're so interconnected.
Jonny Morris is the CEO of the Canadian Mental Health Association for British Columbia. Jonny, it's always a pleasure to connect. Thanks for your time and your wisdom today.
Thanks so much, Bruce, for your great questions, as always.
Thank you very much. I'm Bruce Williams. See you again for another Chamber Chat.